So hello, we're so glad to have you here today. It's such an honor to have someone who is so well known, and I've read all your work and I've been reading about it. It's so amazing to have you here. So why don't we get started?
Well, can
So
I say, when I was in high school, I was doing crossword puzzles. You're you're changing the world, so kudos to you.
much, thank you. Okay, so the first question is, why don't you give us a quick introduction about yourself and how you got to where you are today?
Sure. Couple things that were, sometimes life happens when you're making other plans. I grew up in a family retail business, kind of expecting to join my father and other relatives. But I was born with a heart murmur. I had to start seeing a pediatric cardiologist. I never had any problem from it, but every 6 months, every year. And I thought it was all pretty interesting. No doctors in the family. I had a really nice cardiologist. And if you would have asked me about age 10, I would have said, I want to be a heart doctor. It was just like a crazy little influence. I grew up in a family where we kept Jewish dietary laws kosher. I didn't eat pork. I didn't eat cheeseburgers. And when I went to college at age 18, and I was already accepted to med school early, so I mean, I knew my path. I knew I was going to be a cardiologist. I started eating vegetarian vegan at age 18, very quickly vegan, and I never went back. And that was a private decision. But as I got more into cardiology and medicine, and if somebody said the word nutrition, my ears went up because I was doing a different plan. I was the one not eating French fries and cheeseburgers. So it kind of, even though I went straight to hardcore cardiology and cath lab and heart attacks, I was very interested in prevention, nutrition, and the rest. And I kind of combined them my entire career. Excuse me, nose itching. And about 10 years ago, I said, I really want to study preventive medicine deeper. And I found a university program and late at night and weekends and did a whole year, got a degree in preventive, and really preventive with a what might be called integrative. I mean, sleep, stress, yoga, Ayurvedic, herbal, fitness, nutritional, and finally had, the guts about 6 years ago to leave my former practice, stop going to the cath lab, and basically counseling people on lifestyle. Very advanced, though. I kind of call it high touch, high tech, because, it's about your lifestyle. But I am doing labs and genetics and sleep studies and vascular studies that nobody else is doing in suburban Detroit or Ann Arbor, where I am, southeastern Michigan. So it's a very fun, I identify all kinds of disease and pathology, inflammation, oxidative stress. But then I'm trying to use natural therapies to deal with it. Weight loss, exercise, sleep, stress management, vitamin replacement, herbal approaches, and it's pretty cool. Sometimes people end up feeling great and they're on far less medicine, reversing disease, and sometimes we got to use a combination of Western and Eastern.
That
That's
sounds
it.
great. Yeah.
Are we done?
Oh, no, not yet. We have more. Okay, so the next question is, could you give us a description about your typical day-to-day experiences in your field and what a normal workday would look like for you?
Yeah, so just real quickly, 7 years ago, I mean, I'd get up about 5, go to the gym, zip out of there by 6, and be on the wards by 6:15, including, usually maybe 1 out of every 3, 1 out of every 4 weekends. And I was an interventional cardiologist, meaning 3 in the morning, you need a cardiologist. The emergency room would call me and, zip on in. When that changed 5 to 6 years ago, I only see people 4 to 5 days a week, usually 4. But there's so much extra now because my lab studies and my communication with my patients. So I'm always doing something 7 days a week. I have patients from all over the world, sometimes Zoom, sometimes other, Google Hangouts, sometimes phone, and a lot of local patients that come on in. But late at night, I'm looking at complex labs and emailing, making plans. It never stops, but I don't mind that. It's fun. And I spend a lot more time reading new science, what's new in inflammation, oxidation, what's new in weight loss therapies, diabetic therapies, vitamin therapies, heart detection, heart reversal. I write more. I write books. I write blogs. I very active in social media. Sometimes a little bit of comedy. Sometimes too much politics. Mainly medicine. I finally posted a. I've been posting a lot on COVID, and my peeps are saying, what happened to broccoli?" So I had a parsley post today about the biochemistry of parsley, because it's a very interesting chemical in parsley called apigenin, and I had recently been reading about it. So, but really, it's that whole person approach. What's your family structure? What was your upbringing like? What's your sleep like? What's your dental health? What's your dietary history? What's your fitness? What are your coping mechanisms? Is your coping with tequila? Is your coping with Xanax? Are you coping with a walk outside in fresh air, listening to, calming music, Mozart or something? So, I really get to know these people pretty well. Know the name of their kids and their dogs and all the rest, their cats. I don't care about cats, so I don't ask about the name of their cats. I just want to know about their dogs. But if you have a cat, or people that have a cat, it's okay by me.
Okay, so the next question is, in your experiences, are there any major challenges you faced or had to overcome? And if so, what were they and how did you overcome them?
Well, I always, have a challenge. I need to take good care of myself. There's a very famous business consultant. He passed away, but Stephen Covey, and he wrote that book called The 7 Habits of Highly Successful People. Sold millions of copies. And one of the habits was you have to sharpen the saw. If I'm going to be ready to help other people and talk about sleep and diet and fitness, I have to do these things myself, or it's not authentic. And I could always lose 3 or 4 more pounds, but every day I'm doing flexibility and weights and cardio. Might only be 25 minutes, but I've got to do that. And I've got to eat well and manage my alcohol intake and work on my sleep. I mean, I'm a much more effective physician when I can talk out of authenticity. I've tried 33 things for better sleep, and here's 5 you might want to try. So that's a challenge, taking care of me and not letting job and life dominate my own health. I mean, I won't be much good to people if I'm ill. And all. Challenges. A lot of people think I'm crazy. In the social media world, I get attacked all the time. If I post scientific literature, I get attacked all the time. You think that would be a fair game to introduce some other idea, but I've never been shy of a little bit of, back and forth debate style conversation. Sometimes it's just frankly ugly, but never been too bad. That's a challenge, but you can't let it get to you. There should always be open scientific debate in medicine, whether it's bypass stents, cholesterol, statins, COVID therapy, COVID vaccines. We should be able to discuss all these, but sometimes, emotion gets put in front of science, or politics get put in front of science. I mean, I also have kids and wife and 2 dogs. Forget about cats. So I got to have some life balance. A lot of us suck at that. I'm not perfect at it, but it is, my family understands this is what I'm passionate about, and we do have life balance. So those are, I think, the biggest issues. And just staying up. I mean, the rapidity of change, trying to, not miss a key article in my field, but it's very hard not to miss a key article. Try not. Google alerts. I have Google alerts on every topic in the world,
Okay, so you talked about balance. So how do you balance it all? Because I've seen your website and you've done so many
on
things.
one leg like this, and I try not to fall over. That's how I balance.
Okay.
Very little answer. Yeah, but go ahead.
Yeah. So is there any advice you would give to us that we should start doing, or something like a habit?
I think you do have to do self-care,
Self-care.
self-love, self-care. You got to take care of yourself. Eating crap is not the route to good health or being a good physician. Avoiding the gym, smoking, blitzing with tequila all night long. Yeah, you got to take care of yourself. You got to shut. I mean, I never shut my phone off. I should take a cellular detox, a social media detox. It's easy to say. I haven't done it in years, but I don't get stressed out by that. I find it interesting and effective to keep up to date. I mean, the core is get good sleep. If if you're sleeping well, and when you're your age, it's a little more forgivable. I'm decades older than you, and if you have sleep pathology, you're not going to have a very good day or very good productivity or probably very good health. So I make that really, really key.
That's good. Okay. So I've seen that you've written a lot of articles and even books about being vegan and how it's benefited you. And you touched on this. So what got you more into the holistic way? And you've also talked about how you're constantly getting attacked on social media and all that, and you continue to talk about it. And so how do you do it, and what really got you into it?
Well, again, I got into it accidentally in that freshman year of university and felt good. My girlfriend felt good doing the same plan. Next week, we're celebrating our 40th wedding anniversary, so it's worked out well in every regard. A good woman. I studied science, and it's impossible not to see science over and over. Red meat dementia, red meat cancer, red meat diabetes, red meat heart disease, red meat COPD even. And that doesn't mean zero for everybody, but it certainly means doesn't look like a very healthy choice overall in excess. So, I mean, the science supports it. Anti-aging, I study a lot in longevity and anti-aging. It generally, it's obviously kinder to animals. And I get attacked. Do you know when they grow those soybeans, they are probably running over rodents with those big soybean harvester machines? Okay, I apologize to the little rodent. But the idea of slaughtering calves and cows and pigs and billions of chickens is a little more emotional to me. They're a little higher up the ladder, and every life is precious. But once in a while, your car runs into a bug and it dies. I mean, I can't avoid them all. I'm pretty careful about taking bugs out of the house. I'm not crazy, but when I have a chance, I will actually liberate them. On average, and I think there is some genetic variability. Some people respond to a lower saturated fat diet, a higher plant diet. Some people seem to respond to a diet that maintains some seafood and meats. We don't understand all of the genomics of all that, but you can study it. But generally, for the environment, for the animals, and for the health, and also all this biotoxicity out there, the fact that fish accumulate PCBs, DDT, other endocrine disrupting chemicals, that they're injecting the majority of the beef and the chicken and the turkey with hormones and antibiotics and salt, and just the quality and the cleanliness. Certainly suggests you should have a plant-forward diet, Mediterranean, DASH, or if you do it well, a plant-only diet works out well for many people. Not everybody, but for many people.
I see. Okay. So you also wrote a book called Dead Execs Don't Get Bonuses. So what encouraged you to write that? Yes. Yeah.
Buy it. No, it's inexpensive. I just have it on my desk. I was invited to a pretty prominent marketing group, actually, in Phoenix about 9 years ago. And really on the spot, they said, it's really a big honor, but we give people time to give exactly a 10-minute talk. If you talk 10 minutes and 1 second, the microphone goes off. And the second part was the talk has to be so valuable that everybody in the room is going to make $250,000 or more from your talk. And these were marketing people, so it could be a new digital strategy. The only thing I know how to tell them is if they don't die, they're going to keep making money, because these were pretty big earners. So I gave a 9-minute and 50-second talk, how not to die, how to know how to check your heart in more detail so that you aren't going to walk out of your internist's office with arteries full of plaque and have no clue, because heart disease can be silent. So that was so well received that I wrote a blog about it. And then I said, you know what, I'm just going to put it down as a simple book. And my wife said, you can't call the book Dead Execs Don't Get Bonuses. Somebody's going to be ticked off. And I don't think I've ever had anybody actually, that's the only thing I've done that hasn't ticked people off. So it's really, I mean, I'd give the book away for free. I've given away hundreds of copies for free. I just want people to get checked. And if they don't have heart disease, celebrate it. If they have heart disease, we can deal with it.
Yeah, okay. So this question was sent in to us. So heart and lung issues are the most talked about in this COVID-19 scenario. Doctors are frontline workers in pandemic situations, and so many have lost their lives while working. Life responsibility, death, all around sounds so intimidating. What can parents do to think positively and motivate their kids who are rising medical leaders?
Yeah. I think we have learned again that lifestyle is huge. I mean, how do you predict serious or deadly COVID cases? I mean, partly it's age, and we aren't yet able to turn the clock back. We can work on optimal health, but until you're 70 years old and really 75, 80, the mortality curve doesn't really start to rise. It really starts to rise after age 75 and 80. But obesity, diabetes, advanced heart disease. At the beginning of COVID, we thought for sure high blood pressure and some of the medications for high blood pressure might be a risk factor. We're not so clear about that now. But what should the message have been from the president then, the president now, the Surgeon General, the director of the NIH for this task force? It should have been, ladies and gentlemen, never before has it been more clear that you're likely to die of heart disease and stroke, but the same approach will reduce your risk of deadly COVID. Drop the weight, eat the beans, go for a walk, quit smoking, cut back on alcohol, get sleep at night. We had that opportunity, and I've written articles like that a year plus ago. Others have, but it's not very often that you're hearing that. Take some vitamin D, take some zinc, take some quercetin, take some vitamin C, get sleep with melatonin. These were all recommendations from a professor in Virginia at East Virginia Medical School, March 2020.
Yeah.
Most people didn't hear that. We heard about masks and washing hands and isolation, which seemed to be appropriate. We're all questioning that a bit now with an email dump that came out in the news regarding our NIH director, but that's politics, and I want to stay to medicine. So, we got the positive spin on this is those that actually really do take good care of themselves have been less likely to get severe cases or even succumb to COVID. There's no guarantee, but it's certainly less likely.
Yeah, for sure. Okay, so this one was also sent in. How important was the decision of picking the school in your career? At high school, currently, it sounds like the most important decision, and every child is under constant pressure, is to go to the top school.
Yeah.
Any advice on our members who are in high school right now?
More important is your own work ethic, your own habits, and mentors you'll meet that you don't even know who they are. I applied to University of Michigan, one school. I mean, I was a good high school student. I wasn't the valedictorian. It turned out couldn't have been a better experience had I gone to Harvard. I mean, it's always nice to have a Harvard degree on your curriculum. There's a lot of weird people at Harvard. But I will tell you, when I finished getting towards the end of med school, and I had done well. I was Summa Cum Laude in my med school class and had a lot of research by then. I really liked med school and had really worked hard. I wanted to be a Harvard resident, and that blew up. I spent months at Harvard as a fourth-year medical student. They didn't care about me. I wasn't blue blood. So I got a big no on match day and stayed in Ann Arbor. Worked out amazing. I had the best 3 years staying where I was. I knew the lay of the land. I did lots of research, published research. But then I wanted to be a cardiology fellow at Harvard. And I interviewed. Blew up. I was devastated. I was accepted to University of Texas Southwestern in Dallas, one of the top 10 programs in the country. I didn't want to go to Dallas. I wanted to go to Boston. Turns out, best 3 years ever. Met the best mentors. I had the best research experience, clinical experience. And then I decided at the end of fellowship, I wanted to be a cath lab stent heart attack. And I had heard through the grapevine, this little program in Kansas City was the most vibrant, amazing program in the world, not a university. And I don't know how the Lord above, there's only 10 people in the world can say I was accepted to that program and worked with basically like the Albert Einstein of angioplasty. His name was Jeff Hartzer. So, I mean, everywhere I tried to make plans, other things happened and they worked out for the best. Partly because I'll give myself a little credit. I always worked hard. I found who was the mentor that might work well with me, and I might work well with them. I always tried to do extra by writing research and asking. And I don't know what my career would have been if I actually had gotten into Harvard residency fellowship. I think I would have been some kind of, research nerd. And I love people. I always wanted to be a people doctor. That's all I do nowadays is talk all day long. I'm like a psychiatrist on the couch, just talk. But people are interesting. Not everybody's lives are so sweet. So if you don't, I feel badly for people that aren't getting accepted to med school. And, but even then, okay, you're going to take a year, you're going to work or do research or something. It may end up proving to be amazingly helpful 10 years down the road.
Totally agree. So this is our one last question. What information do you think high school students should know before committing to this career path?
Well, I'll tell you something interesting. I got accepted at age 17 into a program in Ann Arbor. It doesn't exist anymore. It existed a few places. But you got accepted to med school out of high school, but you did 6 years, not 8 years, all combined. And they knew that some of the people that got accepted to that program were probably not in the right career. And they made you do 6 weeks of a clinical medical experience in your first year. You're 18 years old. You're working in an emergency room, in a labor delivery, in an allergy office. I ended up sleeping in a hospital in suburban Detroit for 6 weeks. So the point of that is get around the situation. See if you can shadow. See if you can volunteer. If you find out every time you smell alcohol and see blood, you pass out, you probably want to become a psychiatrist. All right. You might want to become an engineer or something. Not everybody needs to be a doctor, and not everybody's going to enjoy the experience. And out of the 50 people in my class, a few dropped out in the first year or two, and they probably made the right choice. So it's a lot of hard work. It's very expensive. Make sure you're in the right field, and you can still morph. There are people with MDs. I just had dinner last week with a guy with a medical degree and a surgical residency degree. He's selling real estate. Now that's very unusual. It happened to be a family business, and it's one of the biggest real estate businesses in Detroit. But there are people that go into finance and hospital administration and education. So you can take your degree. And I get that a lot. Doc, I want to be integrative, but all they teach me in med school is drugs and surgery. And you got to do it. You got to pay the time. Get the degree. Once you got the degree, you can decide what you're going to do. But, an MD or a DO or even naturopathic doc, ND at the end of your name, PhD, you need to do those things.
Mm-hmm. So is there any other advice you would like to give to us or anything else you would like to say?
Just be passionate. Find something you love. You'll never work a day in your life. You'll just show up and have fun. So yeah. Okay. The Japanese call it ikagi, a sense of purpose and a sense of passion. So if this is what you want to do, fight for it. Go get it.